Many people make the mistake of assuming that a pregnant woman can stop using drugs the second she finds out that she is pregnant. It's said that the maternal instinct should take over and she should no longer have cravings for the drugs. Unfortunately, this isn't the case. There are many women who try to stop using drugs but aren't successful with their efforts because their addiction is too strong. When this happens, babies can be born addicted to the drugs, and the mother will need to go through treatment in order to be able to overcome her addiction. Suboxone is often used to help make battling an addiction easier. Suboxone is a controlled substance that must be prescribed by a medical professional. It contains buprenorphine and naloxone. The buprenorphine helps to reduce an addict's urge to use, while the naloxone reverses the effects the opioids cause. It's ideal for anyone who has wanted to quit using opioids but hasn't been able to overcome the addiction on their own. Many people avoid taking Suboxone while they are pregnant because they fear that it will have an adverse effect on their baby's development or cause mental defects. Many people avoid taking Suboxone while they are pregnant because they fear that it will have an adverse effect on their baby's development or cause mental defects. If you do drugs while you are pregnant, the chances of your baby having something developmentally wrong with them are very high. Studies have shown that babies who were exposed to Suboxone while they were in the womb had no significant differences when tested from babies who were not exposed to it. There are cases where babies who were exposed to Suboxone neonatally did go through neonatal withdrawal. Neonatal withdrawal typically becomes obvious within up to 8 days of birth. Some infants suffer from neonatal agitation, tremors, seizure, respiratory depression, bradycardia, apnea, and more. Doctors closely monitor any babies who are going through neonatal withdrawal to make sure that they are given the care that they need. Many babies who are suffering from withdrawal symptoms do stay in the hospital longer than infants who are not going through withdrawal because they need to be monitored so closely. Studies have shown that breastfeeding is one of the best ways to provide your baby with the nutrients that they need early in life. Mothers who are taking Suboxone to overcome an addiction are often fearful to breastfeed while they take the medication because they are worried that it will cause adverse side effects for their breastfeeding children. It's important to know that while Suboxone does pass through the breast milk, it is at a rate of less than 1%. It's important to monitor your baby closely when you are breastfeeding and taking Suboxone. You want to be sure that he or she is eating well, gaining weight, not lethargic, and not sleeping constantly. If you notice any of these symptoms, you should talk to your doctor right away. You can still produce the same amount of milk when you take Suboxone as you would if you didn't take it. Freezing the breast milk is also safe when you are taking Suboxone. The Suboxone will not become more potent from being frozen. Suboxone has been shown to be very beneficial for many pregnant or breastfeeding mothers because it helps them regain control of their life and be the best mother that they can. If you start using Suboxone to treat your opioid addiction, it's important to take the medication as prescribed. If you are fearful that you may take it improperly, you may want to enroll yourself in an inpatient treatment program so that you can get the help you need. An inpatient treatment program can help you stay on track and reach your overall goal of sobriety. Living with a drug addiction can be very difficult. Trying to take care of a baby and overcome a drug addiction can be even harder. Getting professional help for an opioid addiction while pregnant or after having a baby can help you to provide yourself and your baby with the life that you both truly deserve. It's best to find out what options are available to you as quickly as you can. If you continue to take drugs while you are pregnant or breastfeeding, you could cause unnecessary damage to your baby. The long-term side effects of infant exposure to illicit opioids can be severe and life-changing, so getting help right away could save your baby from a lifetime of complications. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.